Okay, so the topic of my project was how anthropology relates to my major. The goal of this project is to explain how anthropology and our majors go hand in hand. My major is physical therapy, and I think that it relates to anthropology quite nicely. It determines how I treat each individual and how my performance is. Physical therapy causes one to form relations with their patients. Therefore, it'll be very helpful to know what they believe in based on things like where they're from, their religion, and their gender. You can't ignore the differences in people just because physical therapy is in the health field. You have to account for everything. There are three main areas that I would like to cover on how anthropology relates to physical therapy. The first topic is that physical therapy is very involved in touching and aiding your patient to allow them to heal properly. You have to be very physically close with your patient, sort of like a mother taking care of a child just to make them feel good after they fall or something. It might be inappropriate in some cultures for me as a woman to touch another man by holding his arm while he tries to walk. I might think I'm doing my job, but then again, in his culture, it might not be appropriate because of our difference in gender. It'll be my job to try and understand different cultures and work with their views so I can properly aid every patient so that they are most comfortable. Lots of different cultures have different views on touch. For instance, there's a story that illustrates this very well. An African American man walks into a convenience store owned by Korean immigrants. He gives a $20 bill for his purchase to the cashier and waits for his change. She puts the change on the counter in front of him rather than the change into his hands. What's the problem? The customer is upset because he interprets the cashier's not touching him as discrimination because he's black. But traditional Korean and many other Asian countries don't touch strangers, especially of the opposite sex. So this just shows how important touch can be in different cultures. It's very important to know my restrictions with my patients so we can come to a compromise. My next topic is that I would like to discuss would be pain. The main reason people come to physical therapy is because of pain. Maybe we're in a bad accident and it caused one of their limbs to be in excessive pain, or maybe a part of their body just doesn't function properly and it's causing them pain. But more than likely, most physical therapy patients will be in some sort of pain in one way or another. It's my job to understand that some may not want to express pain because they see it as a weakness or something like this. Of course, this would make my job a lot harder. I wouldn't be able to know how bad the pain is or if the pain is even getting better. For some people, it's very hard to deal with. It can be hard to express this to someone because they might feel like they're losing their independence. Being that a patient won't know me very well, they might not trust me. So I will have to build that trust, build that trust so they can express things like pain to me. They might feel uncomfortable and embarrassed, which is pretty common among humans. It's normal to feel like this, so to resolve this problem, I might have to ask them beforehand how willing they are to express their pain to me. If they aren't cooperating very well, then I might have to bring someone in that they are willing to express their pain to. Maybe a man isn't willing to express his pain to me because I am a woman, and expressing his pain to me will make him look inferior. But maybe he will express his pain to a male member of his family, like his brother, his son, his father. My last topic that I would like to discuss would be family. Family is important to any type of race, religion, or origin. In most cases, one would consider someone as family as someone that they are related to. This may not always be the case for everyone. I consider some of my childhood friends as family, even though they aren't related to me in any possible way. So when a patient of mine gets hurt, I'm quite sure a family member might think that they have a better judgment on the health of the patient. Again, being that I won't know the patient for, very long, and I have no prior experience with this patient, the family member of the patient might not think I have the better judgment. They might think that they know what's best for the patient. For instance, a mother might care to her child by bathing them and getting them ready for the day because it's hard for them to do it themselves. And the mother just thinks that she's helping the patient out. Maybe she's helping me out, but in reality, she's just setting the patient back because now he doesn't know how to do basic things for himself, and he needs to learn how to do those things. So this might sound harsh to tell a mother that to sit back and watch her child struggle and do simple tasks like walk and bathe, but it will help the patient and the mother out in the long run, because now the patient will learn how to do those things by himself instead of having someone do it for him his whole life. And sometimes the best way to help someone is just to not help them. So these are all my very important topics that relate to anthropology and my major, physical therapy. Thank you.